All right, welcome to The Explainer. Today we're going to break down food poisoning. And look, this isn't just about a long list of bugs to memorize. Nope, we're going to build a clinical framework, a way of thinking that'll help you crush any food poisoning question they throw at you on exam day. So, let's get right into it. Okay, so here's our game plan. We're going to start with a classic case you might see on an exam. Then, we'll clock the culprits and figure out how they do their damage. After that, we'll cover diagnosis, treatment, and we'll wrap it all up with some super high-yield revision points to lock it all in.
First up, we're diving straight into a scenario that is practically guaranteed to show up on your exam at some point. It's going to be the perfect way to frame this whole discussion.
So picture this. A bunch of people show up at the ER. They were all at a party a few hours ago, and now they've all got vomiting, diarrhea, and cramps. Right away, your brain should be screaming, common source outbreak, food poisoning. But which one? The clock is ticking, literally. And that time of onset, that is our single most important clue. Let's start building this case step by step.
But before we get into the nitty-gritty of the microbes, let's just take a step back and appreciate the scale here. 600 million. That is a massive number. It's the estimated number of people who get food poisoning every single year. That's nearly 1 in 10 people on the entire planet. It's a huge deal, and that's exactly why examiners love to ask about it.
So, what are we really talking about here? The definition is pretty straightforward, but the key phrase you've got to lock in is common source outbreak. See, it's not just one random person getting sick. It's a whole group of people who all ate or drank the same contaminated thing. That's the classic setup you'll see every time.
All right, so how do we start narrowing down the suspects? Well, we've got a secret weapon, and it's the clock. Seriously, the single best way to approach this is by classifying the culprits based on one simple thing, the incubation period. You do that, and you're already halfway to solving the case. Think of this table as your ultimate cheat sheet. I'm telling you, the single most important clue in any food poisoning case is how much time passed between eating the food and getting sick. It lets you take this huge, scary list of potential bugs and shrink it down to just 2 or 3 likely suspects. So let's burn these 3 time frames into our brains.
Okay, first up, the super fast onset. We're talking 1 to 6 hours. If it's that quick, you need to be thinking preformed toxin. This means the bacteria already did its dirty work in the food, creating a toxin before anyone even ate it. It's basically a poison just sitting there. The 2 main culprits here are Staphylococcus aureus and Bacillus cereus. And here's your mnemonic to remember them. Sick before sunset. And what's the telltale symptom? Explosive vomiting. It's all about the vomiting.
All right, now let's say the symptoms take a bit longer to show up, maybe 8 to 16 hours later. Now we're talking a whole different mechanism. In this case, you've actually swallowed the bacteria and it starts producing the toxin once it's inside your gut. To remember the bugs here, Clostridium and Bacillus cereus, just think, come back during the night. And this time, the big complaint isn't vomiting, it's all about those awful abdominal cramps and watery diarrhea. And last, we have the slow burners. If it takes more than 16 hours for symptoms to appear, you're not just dealing with a toxin anymore. This is a full-blown infection. The microbes are in there, they're multiplying, and they're actually invading the wall of your gut. This is where you find the real heavy hitters like Salmonella and Shigella. This group also includes the infamous EHEC, that's the one that causes bloody diarrhea, and of course, norovirus, the bug that loves to ruin a good cruise.
Okay, so we know who the culprits are. Now let's dig a little deeper into how they actually make us so sick. Let's talk pathogenesis.
Now this is a classic exam question, so listen up. We're talking about Bacillus cereus. This one bug can cause 2 totally different types of food poisoning. It all comes down to the toxin. If it's in fried rice, you get the emetic type. It's a preformed, heat-stable toxin, which means reheating your leftovers won't save you, and it causes really fast onset vomiting. But if it's in meats or veggies, you get the diarrheal type. That's a heat-labile toxin made inside your gut, leading to slower onset diarrhea. It's a brilliant distinction to know for your exams.
And now for the big one, the most potent toxin known to humankind, botulinum toxin. The way this thing works is, well, it's terrifyingly precise. It gets absorbed into your blood, travels to your nerve endings, and then it does one thing. It blocks the release of acetylcholine. And if you can't release acetylcholine, your muscles can't contract. The result? That classic descending flaccid paralysis. It starts at the top of your body and just works its way down. A true medical emergency.
Okay, we've got our suspects. We know their MO, but how do we prove it? Let's talk about cracking the case in the lab.
You know, the actual diagnosis doesn't start in the lab with a petri dish. It starts with you and the patient. The single most critical step is taking a really, really good history. Think of it as detective work. What you find out from the patient's story is going to guide every single thing you do next.
So when you're playing detective, you've got 3 golden questions you have to ask. Number 1, when did it start? That gives you your all-important incubation period. Number 2, what did you eat? This helps you link it to specific foods. You hear undercooked chicken, you think salmonella. And number 3, what are the symptoms? Especially, is the diarrhea watery or is it bloody? Honestly, the answers to just these 3 questions can pretty much solve the case for you right then and there.
Here's another one of those super high-yield facts for your exam. The gold standard for botulism, it's not about finding the bacteria, it's about finding the toxin. You have to demonstrate the toxin's activity, and the classic way to do that is with the mouse bioassay. All right, let's shift gears and talk about what really matters for the patient, treatment, and of course, prevention.
Look, if you take away only one single thing about treatment, let it be this. Treatment is almost always just supportive care. You're not fighting the bug, you're fighting the dehydration. That's it. Correcting that fluid and electrolyte imbalance is the name of the game. It is everything.
So the plan is actually pretty simple. Mainstay of treatment, rehydration. Oral rehydration solution, IV fluids, whatever it takes. Now, what about antibiotics? Generally, no. They're usually not needed and can even make things worse, like with EHEC, where they can increase the risk of HUS. The exceptions are for really severe invasive infections like shigellosis. And of course, the big one. If you even have a tiny suspicion of botulism, you give that antitoxin immediately. You do not wait for the lab results.
All right, let's bring it all home with a quick fire revision. We've gone through a lot, so let's boil it all down to the absolute must-know points for your exams.
Okay, this little box here is your entire lecture in a nutshell. You've got your definition, your causes, your treatment, it's all there. But if I can leave you with one thought, one core concept, it is this. Classify by the incubation period. That is the key. It unlocks the entire case. Everything else, the history, the diagnosis, the treatment, flows from that one piece of information. And always, always keep an eye out for those red flags.
So, I'll leave you with this final thought to really cement this framework in your mind. Given how much the symptoms can overlap, what's that one single piece of information from the history that's going to guide you? You know the answer. It's the incubation period. That is your key to cracking the case every single time. And that's it for this explainer. Good luck with your...